The two approaches to helping with pain is regenerative medicine and neuromodulation. Chronic pain is typically a pain that lasts greater than 3 months. And so acute injury, you have some tissue got damaged, it's emitting chemicals, those chemicals sensitize the nerves, and that results in a pain signal that's transmitted to the brain. And so there are two ways of treating it, and actually truly treating it and getting rid of the pain, not just covering it up or making the symptoms better. Okay, so here's like the biceps tendon. Let's say they lifted too heavy of a weight, and the tendon where it attaches, generally tendons attach the muscle to bone, and that tendon actually doesn't have a great blood supply, and so it can take a long time to heal. So what you can do is something like a corticosteroid injection will improve the symptoms, but it actually doesn't heal the tendon. You can inject steroids and it'll make it feel better so that you can do physical therapy, but it doesn't actually help the tendon heal. Well, the advantage of regenerative medicine is that you'll inject something that will actually help with healing, which is platelet-rich plasma. So basically, this is where we get blood from your vein, and we put it in a centrifuge. And then what the centrifuge does is if we take a tube of your blood, it separates it into the red blood cells, and then there's a layer of white blood cells and platelet. And so we just take the portion that's the platelet, and that's where all the growth factors are. And so it's those growth factors there that will heal the injury. The thing I like about this is it's all natural. It's your own body healing itself. You're just taking one area of your body and putting it to another area of the body. And so generally to increase blood supply and blood flow. The disadvantage I can tell you is that it's not covered by insurance, a cash option. So for people who can't afford regenerative medicine injection, there is something called 10X. This is only for tendon injuries. It's actually a really tiny needle. You pump in water in this end, and in this other side, the water comes out this way, and you basically just wash out the tendon. So you remove the injured tissue so that your body can regenerate and build new tissue. Any type of injury that you're having, typically the muscles and tendons are affected, and so one of these two options is generally helpful. The last thing I want to talk about, there are also stem cell types of treatment. I basically can either get stem cells from your own body, from either the abdomen, from the fat tissue, or from the bone marrow, just like the oncologists do for their cancer patients. It's just done with like a needle, but it's slightly bigger and it's a blunt needle, and you just withdraw it from one area and then inject it where the area that's painful. The advantage is that stem cell treatments last a lot longer than the platelet-rich plasma treatment, but it's also more expensive. The other treatment that really works for chronic pain, and that's the neuromodulation. So if your pain has gone on for more than 3 months and hasn't gotten better, then typically what's happened there is that a lot of the pain chemicals that are being released, but when it goes on for a month, when you have chronic pain, these substances end up sensitizing the nerve, and there's a positive feedback loop where the nerve goes to the brain, stimulates pain, but then the brain and the spinal cord forward on each other. And so what we need to do is interrupt that signal. So what neuromodulation is, basically right next to the nerve, we'll place a little tiny wire. It's actually like a little tiny electrode. So instead of getting an injection of liquid like numbing medicine, I inject a little tiny, almost looks like a piece of floss. It's very flexible. It's like a little piece of string. And the nice thing is you can turn on that electrode with your phone and it will send a signal. And what that does is it prevents pain from being transmitted to your brain, and it completely interrupts this process. So you can actually send different types of signals. Like a TENS unit, you can send like an electrical massage feeling, or you can do sub-perception stimulation. And that's where the frequency here is so high, you don't even know that it's on, but what you know is that your pain is gone. And so you may have heard this described before. It's called a peripheral nerve stimulator or a spinal cord stimulator, depending on where it's placed. And then you can see, did it reduce your pain by 50% or more? Are you able to now walk, work, do all the things you couldn't do before? And if so, then that's successful. What happens when the pain is generalized? All of the nerves in the body, they do run through the spinal cord. The brain does have pain receptors, but much of the brain actually doesn't feel pain. That's where pain is interpreted. The other part about neuromodulation is that it's not just blocking the transmission from the nerve to the brain, it's also putting input into the nerve that goes to the brain. You can actually change the brain activity by putting this stimulation into the nerve using a lead that then goes to the brain is one way of treating pain, because you're blocking a signal, we're adding a new signal, and that new signal is generally a non-painful stimulus, and it helps distract the body from the pain. It overrides the pain signal. Simplest version of this technology is a TENS unit, and that's just kind of where you put electric pads on the muscle surrounding wherever you're feeling pain, and you can turn it on and it creates a nice electrical massage. Now, the problem with TENS units is because usually they are placed on the skin. If the nerve is or the painful area is underneath bone, or if it's deep, the TENS unit's not going to get there. These trials that I mentioned here, this is done with an injection, and then it's just taped on the skin to a bandage. And at the end of the 7-day trial, we just pull off the bandage and the lead comes out. And so it's like you never had anything. So if the trial was not successful, no harm done, nothing lost. But if it was successful, we can then get you the permanent version.